Well, more patients are asking doctors about something called Kratom and whether some of its substances can help them reduce their pain. We're getting some answers today on the medicinal benefits, but also the warnings if you do use it. Here with more on this is local neurologist Dr. Chad Domingue to answer some of those questions. Thank you as always for joining us.
Well, I hope you had a good Thanksgiving.
Yes, you too. Okay, so we know that this is kratom is a tree that grows naturally in countries like Thailand. People there use the leaves for things like tea, for recreational drug purposes as well. But what's in it that some people believe can help actually fight pain that could be helpful?
This is probably the most interesting substance that I reviewed over my literature search looking at supplements. You know, when you look at kratom, it's banned in Southeast Asia, Malaysia, the country where it got its popularity. The two active substances in the plant are metragonine and 7-hydroxymetragonine. Just so the viewers understand, the FDA labels both of those substances as opioids. The DEA wanted to make kratom a level 1 substance, so heroin, marijuana before it became legal. So when you look at kratom, it works like an opioid. At low doses, it acts like a stimulant. At high doses, it acts like an opioid. You mentioned Thailand. The plant factory workers actually chew on the leaves as they work. They call them chewers because they do 10 to 60 leaves a day to give them that stimulant opioid effect to allow them to do the physical labor. So this is a very interesting compound that has some very severe effects on our central nervous system.
Okay, let's break it down into the good and the bad because the FDA has issued a warning. First of all, is it legal in Louisiana to buy this? And as a doctor, what could it be used for in a safe way?
So it is legal, and this is the mind-blowing from my end. You know, you and I have talked about marijuana all the time. You do not need any doctor recommendation. You can literally walk into any shop that sells this product and buy it. I mean, so there is really very limited regulation. There are some states where it's illegal. Florida has banned it, but literally across the country, you pretty much buy this without any type of regulation. The studies show that it has a stimulant effect, so a caffeine type effect at a low dose, and people have used it to come off of opioids. So the opioid effect is not as strong as a morphine or a hydrocodone. And the thing is interesting, they have 150 years of data in Southeast Asia. And the people that take kratom as opposed to opioid users, they still function at a high level. So they don't have the negative, worn down, the look of someone taking high dose opioids. So even though that effect's there, it's not as profound. So stimulant, pain relief, mood stabilizers, these are the things that people look at for kratom to help.
So when patients come to you and say, Doc, can you help me use this? Are you advising them to do this? And what kind of pains can it help with?
Yeah, so, it can help any pain. So any opioid effect can help any pain. The problem is I can't test for it. So my patients that are taking a hydrocodone or Percocet, the drug screens that we do not test for kratom. My concern for kratom is due to the basically absolute no regulation of it. Anyone can go buy it. And if they're not talking to their doctors about it as they're taking it, if they're taking a stimulant, if they're taking something for depression, if they're taking opioids, there's a huge relationship of these compounds. And again, I can't test for it. And unless a patient tells me, I have no idea they're on it.
So bottom line, the worst side effects for this that you would warn about if people are even thinking about this, and what do you tell people overall, the bottom line on this?
Yeah, bottom line is you have to have a huge caution with this. So do not let the lack of regulation fool you. Make sure you talk to your doctor. Make sure you look at other things that you want. But the biggest side effects would be things you see with opioids: respiratory depression, addiction, mood changes, alteration of chemistry in your body. But again, for me, the big warning to our viewers is if you're looking at this for any issue, please talk to your doctors, because do not let the over-the-counter lack of regulation that this compound has fool you. This substance works like an opioid and a stimulant, and you need to be taking this under a doctor's supervision, in my opinion.
Okay, thank you so much, Dr. Chad, always bringing us up to date on what patients are asking about. Appreciate it. Have a good day.
Absolutely. You as well. Take care.